Everybody good to go? Good morning, everybody. Thank you for being here this morning. And Councillor Pong-Yu is here with us as well. Good to see him. Just a few opening comments, and this shouldn't take me too long to go through this, and then we'll have a Q&A after that. If you are so interested, obviously I'm here with the City Manager, Norm Gale, and he'll be available to answer any of your questions as well. So in your package, I think you all have it. You've received a chronology that shows what we have been doing relative to COVID-19 up until this point, beginning for me back in late January with a meeting that I had with the Medical Officer of Health at the end of January, and then a meeting or two that happened shortly after that, as we made sure as a city that we were as prepared as we possibly could be for what we weren't sure would eventually arrive. And it hasn't yet. To the point, COVID-19 is not and has not yet been identified at this point in the city, but obviously all of us are aware that that can change at any point. This is a rapidly changing and evolving situation. This morning, and as quoted in your press release, I was on the phone with Dr. DeMille, the Medical Officer of Health, and it is her recommendation at this point that we not take any immediate action on closing city facilities or canceling any program. Now, of course, that can change an hour from now, a day from now, and of course, individually, families can make their own decisions in terms of whether or not they want to continue to access programming or events that the city continues to put on at this point. But again, that could change an hour from now, a day from now. We may be in a very different circumstance on Monday. But at this point, as informed by my conversation with the Medical Officer of Health this morning, that's where we are. Again, I stress that families individually can make their own decisions. In each meeting that I've had so far as well, it's important to note that I've raised the issue relative to our long-term care homes and to the staff there. There are and have always been existing protocols in place to deal with them. Your press release that you've received this morning details the changes that we have made with our long-term care homes in terms of the advanced screening that's now taking place and the change in visitation allowed at the facilities. Staff travel for business has been canceled. Anybody that has to travel on city business at this point, that is over. As well, there is the option of a declaration of an emergency. The Medical Officer of Health, Dr. DeMille, can declare an emergency at any point. She can place orders that would be binding upon the municipality, as well as the mayor through our Municipal Emergency Control Group. I can declare an emergency, but that is not the point. We haven't reached that point yet. As well, there's been some federal funding announced. You're aware of that. I think that money will be flowing through the provinces. It is likely that that money will be available for public health facilities, hospitals, and the like, but we will be paying attention to that to see if we need it, if there is anything there that we can access to help us with our work as it changes and unfolds. And finally, I would add that internally, the city manager and a senior management team have been working diligently on internal plans for our staff and for our departments. And if you have any questions relative to what may be happening internally, the city manager is here and he will be able to speak to those. So that's what I have to offer you this morning. If there's any questions, we'll do our best to answer those for you.
With the province closing the schools, there's no plan yet to close any of the city-run daycares?
That's correct. So we've talked about that, and we just found out a short time ago that 2 of the city-run daycares at Ogden and at Woodcrest are affected. Those, of course, are daycares that exist in public schools. It's a decision to close by the public school system, not by the City of Thunder Bay. And so at this point, those programs, like everything else that we offer, as informed by the Medical Officer of Health, will still continue. Business as usual for now. That can change in 1 hour, it could change in a day.
Can you speak to the economic impact on the city? There's people facing hardship right now just because, travel plans or events have been canceled after they paid money to travel to them. Obviously, we're hearing about people staying home, not going to events. The Mining Safety Conference in May has been canceled. Has there been any effort so far to assess what the potential economic impact on the city is going to be and what kind of help may be available to the city, to individuals?
Well, part of what I said near the end was there has been some federal money. I think I think the city manager told me this morning, $1.1 billion. I think that's across the country. At this point, a relatively small amount of money, and it's our belief that that money will likely flow, or is going to flow through the provinces, but will likely be used more around public health, hospitals, public health units, and the like. So we don't know what, if any of that, will be available to the cities. Economically, there is going to be an impact, obviously. What it will mean for the city of Thunder Bay specifically as a corporation, at this point I don't think it will be significant. But certainly if you're a restaurant, if you're a hotel operator, there may be significant impacts. The one operation within the city that we're aware of that is being impacted now and will be on a go-forward basis even more probably will be the community auditorium. We don't know what it will mean for the Canada Games complex. We haven't made decisions around those facilities as of yet. Business as usual, generally speaking, for the city, but of course we're keeping a very close eye on it.
Can you elaborate on the auditorium quickly?
Well, the information that we have back, again, through the city manager is that they are seeing some shows I think have been canceled, I'm not sure, but certainly that some people that have bought tickets for shows that are still pending, been canceled, or still going to happen, I'm not sure, where people are looking for refunds for their tickets.
What about vulnerable members? You mentioned, say, seniors and seniors' homes, but what about, say, homeless people, people on the street, living in shelter house? Are any steps being taken to provide supports to them, testing in any way, or?
Well, the testing, of course, is not the responsibility of the city. The shelter house is not a city-run operation. The city does provide funding to the shelter house, about $400,000 a year, but they have their own board and they make their own decisions. And again, the city is not responsible for any of that testing. We would encourage people to do what they can to get tested if they believe that they may have been in contact with someone. But of course, when it comes to those health prescriptions, we would advise people, don't look to the City of Thunder Bay to tell you what you should be doing about your own health. Look to the Thunder Bay District Health Unit or other healthcare professionals for that kind of advice.
So any thoughts of limiting public access to things like city council meetings?
Actually, there is. I mean, we talked about that this morning. We talked about whether we should go forward with any ward meetings that are planned. But again, at this point, based on discussions with the medical professionals, that's what's informing what I'm saying to you today. And we did discuss both of those same things. Monday night's council meeting, should we close it to the public? Should we close City Hall? Should we still have ward meetings? At this point, we're moving forward without any major changes, but again, that could change in short order.
I'm kind of curious, we've been hearing all these stories. I mean, anybody that's gone to like Walmart or Superstore has noticed that there is no toilet paper left. And there's a lot of panic buying and this kind of thing. I mean, is the city or anybody doing anything to make sure that, if people in need actually need some of the stuff that's not available in stores, do we have like kind of a process in place to make sure people can get hand sanitizer and stuff when they need it?
Well, I'm not sure what role the city could play in providing product for people. What we did talk about this morning was our ability to maintain business within the city and our ability to ensure that our supply chain, as best as possible, is showing continuity so that we can continue to provide the services to the people of the city that we are responsible for. And so we obviously have our own concerns around that are no different than any other municipality right across the country that they're faced with today. So we are paying attention to the services through our supply chain that we have to provide for. We will plan and do the best that we can to ensure that that supply chain is not interrupted and that we have everything that we need to continue to meet the needs of the community in the service areas that we are responsible for.
Do you have any estimates about this maybe affecting public transit, anything like that? That is something gathering people?
Yeah, absolutely. It all gets talked about, but again, public transit falls into the same category of services in what we've already addressed so far. The medical officer of health believes that so far there is no need in the immediate term, as we speak to you in this moment, for us to change anything that we're doing. But again, that could change tomorrow. There is a bit of a balancing act here, to be fair. People rely on transit. They can't get around. They can't conduct their daily business. They can't get to a medical appointment if we were to cancel transit. There are impacts with those decisions that could be very negative and consequential for people that rely on them. Having said that, there is potentially negative consequences as we do continue to provide certain services. So We will be paying very close attention and getting our guidance from the medical officer of health when it comes to those decisions. We can make our own decisions around those programs, to be clear, but that's why we rely on the medical officer of health and the healthcare professionals to inform the decisions as much as we can around the decisions that we make.
As much as you take the knowledge from them, would you be lending your own advisory from, you know, the position of mayor, city manager, to private enterprises? Like, if this, you know, kind of keeps snowballing?
I would expect that they will rely on the same people that we rely on. They will be looking to healthcare professionals to inform the decisions that they would make, I would expect.
What about anything like the police station, jail cells, holding cells, anything like that, that, you know, the city does have, I guess, a part in? Has there been any discussion about, I mean, we all know there's already overcrowding in jail. That could be a breeding ground.
Well, the jail is a provincial facility. That's not the responsibility
Yeah.
of the city of Thunder Bay. You know, I think that when we talked a lot about this morning, where what you're hearing from healthcare professionals when it comes to social distancing is when you get into crowds of 250 or 100, one or both, where that's where they feel you hit a bit of a tipping point in terms of some negative consequence. I can't speak well to that. But I don't think you'll see that kind of number, that kind of gathering when it comes to the police facilities.
Maybe last time we were speaking with Norm, you had mentioned that from, I believe, the SARS outbreak, that the city had stockpiled certain personal safety equipment like face masks. Are they still good, or did they expire at all, or can they still be used?
So the city of Thunder Bay does have stores and reserves of personal protective equipment. These apply to emergency responders and healthcare workers and other specific small areas. The way we've handled that since SARS, about 15 years ago, is that we've cycled through the stock. So it doesn't just sit there for 15 years, we rotate it.
Okay, so it's still
Yes.
usable. Okay.
It's a good question, and it's one of the first things we met after my meeting with Dr. DeMille at the end of January. We had a meeting of our internal group, and it was one of the first things that came out of there from those folks was that in fact we did have what we needed in that regard. Okay?
When, I'll ask a small question about transit, which is, you know, in the meantime, while it's still operating, I mean, are there any like sort of small mitigative effects that you're putting into place, like making hand sanitizer available on transit and that kind of thing?
Yeah, for sure there is, yeah.
So our executive management team has been meeting regularly lately, and we are looking at several mitigating factors. Like you, we're a purchaser. We don't have special access to hand sanitizers, and when there's a shortage of hand sanitizers, it applies to us as well. Regardless, we do have stores, and we are cleaning facilities now, and we were reviewing the level of cleaning and disinfection that those facilities need. This is a work in progress, but we're on it.
Mm-hmm. But what about like actually putting hand sanitizer on the bus, so when you get on the bus or get off the bus, you can like wash your hands? Because, you know, let's face it, everybody's touching those handrails, right?
So we have hand sanitizer in all facilities right now, and we're watching and monitoring the levels of hand sanitizer in those facilities. We have not determined whether to put them on public vehicles yet.
Okay.
We'll also acknowledge Councillor Oliver has joined us as well.
That was perfect.
Okay? Well, okay. Okay, thanks everybody. Appreciate you coming out.
Okay, bye guys. Thank you.
Thanks.